and welcome back to the WHY-O-MYO Podcast. This is Janine Steen, your host, hoping to answer your questions about the who, what, where, when, why, and how when it comes to myofunctional therapy. Hi, and welcome back to the WHY-O-MYO Podcast. I wanted to discuss a little bit about the lack of education that's being provided when it comes to the understanding of myofunctional therapy. As a provider and a myofunctional therapist, I spend a lot of my time, or my office spends a lot of their time in the community and offering free lectures for school districts and dentists and orthodontists and dental schools and dental societies, study groups, in order to increase not only the awareness of what myofunctional therapy is and what it can do, but also help to support the relationship that should exist between a myofunctional therapist and a dental provider. Another problem seems to be that many speech pathologists and many master's and undergraduate programs in speech language pathology doesn't address what myofunctional therapy is, what a tongue thrust is, and how to identify that tongue thrust. We are taking the time currently to continue to impart that understanding and impart that knowledge on not just those medical and dental providers, but also that those current and soon-to-be speech-language pathologists, so that they are better able to not only identify, but to either become trained or to refer a patient to a myofunctional therapist. In the 20 plus years since I've been practicing myofunctional therapy, I have seen a tremendous amount of success. I have worked hand in hand with many dental, orthodontic, and medical providers, and have definitely found that there is a significant amount of value to myofunctional therapy, especially when it is required to affect or improve that tongue thrust or symptoms associated with that tongue thrust. Now, do I think that myofunctional therapy is the end-all be-all always and should be practiced in a vacuum? Absolutely not. I think as a speech-language pathologist or any medical or dental or rehabilitative provider, if you keep yourself in one box and you try to focus on only one type of intervention, you are bringing your patient into that box with you. So I try very hard not to check any one box when it comes to treatment and therapeutic intervention as a practice, and the clinicians that we train as part of our therapy regimen. It is important for me that they know as much about everything and anything that they can, as I do think there is a value to all types of therapeutic interventions, especially if it complements or supports the myofunctional therapy program. It is very seldom that I can see a patient stuck in just needing one type of intervention. Many of our patients come in and there is so much that is going on in terms of what's impacting or causing their symptoms that I am doing, or I would be doing them a disservice if I said, nope, this patient only requires myofunctional therapy. I do, however, feel that the framework of myofunctional therapy or the exercises that exist within that framework of our myofunctional therapy regimen specifically can definitely have a positive impact on other types of treatment that may not necessarily be related to a tongue thrust or related to a tongue thrust swallow. Oftentimes, it is in the best interest of the clinicians that are working with these patients to be able to go into their toolbox and grab a specific type of approach in conjunction with the myofunctional therapy approach. Or sometimes it requires them to put the myofunctional therapy approach on hold as they focus more specifically on a specific area that requires treatment that may not necessarily be able to be addressed with a myofunctional therapy regimen. I think as clinicians, it is extremely important for us to be able to expand our skill set and to know as much about different therapeutic approaches as possible, especially if we want to have a positive impact and a positive effect on the many patients or the many different types of patients that we see. It also brings me back to the point that a dental hygienist can be a myofunctional therapist. And I'm not saying that a dental hygienist is not well trained or does not have a firm understanding of the oral cavity and the bones within the oral cavity. However, when it comes to myofunctional therapy and the patients that require myofunctional therapy, we are addressing areas that don't have anything to do with the bone, in addition to correcting the areas that have to do with the bone. So if we are working on a patient's dietary repertoire or their range of motion, or their ability to chew and swallow, or the ability to negate compensatory strategies or implement compensatory strategies in order to improve their diet, that is not something that falls within the scope of practice of a dental hygienist. And it is necessary for a speech-language pathologist trained in myofunctional therapy to be able to shift gears and perhaps shift into more of a feeding therapeutic approach. The same holds true when we have a patient that comes in for myofunctional therapy that has reduced overall intelligibility, or their articulation is affected as a result of their tongue thrust. As a dental hygienist, you are unable to address the articulation, and when we are speaking of a tongue thrust and the negative impact of articulation, we have to think about how often we are swallowing. And if we are swallowing 1 to 2 times per minute, but we are also thrusting our tongue every time we articulate or have a conversation, then if that thrust is not affected or is not addressed in regards to or with regards to the articulation or their speech, then we are only, or that practitioner, that dental hygienist, is not addressing all areas where the thrust is having a negative impact. One of the things that I preach, especially with our office myofunctional therapy program, which is called SPOT, that has just been recently trademarked. And SPOT has to be is only to be utilized by speech pathologists, and stands for Speech Pathology Oral Myofunctional Training or Oral Myofunctional Therapy. SPOT is also a great acronym because we do need to work on speech, resting posture, occlusion, and temporomandibular joint. So if a patient is seeing a dental hygienist, the acronym SPOT will not all be a focus of therapy. So the speech will not be addressed. Resting posture definitely could be addressed. However, it is important to assess a person's resting posture and determine where that posture plays a role when it comes to overall intelligibility and pre and post articulatory placement when a person is having a conversation. So even though our patients may be well treated and well attended to by dental hygienists that are trained in myofunctional therapy, it is definitely a disservice to those patients that have either not been evaluated by a speech pathologist, myofunctional therapist, to determine whether they require more speech intervention. It was also a disservice if we are not able to work directly with those patients. It often requires a dental hygienist to have a patient to work with a dental hygienist trained in myofunctional therapy, as well as a speech pathologist. And in this time and during this generation, it is hard enough to attend one therapy per week or 2 therapy sessions per week with home exercises. Never mind 4 therapy sessions per week with home exercises. If you could see one provider and it could wrap all of those areas of concern up with one approach to therapy and less out-of-pocket expense, I feel that it is in the best interest of the patients to get that type of care and that type of expertise. I hope I was able to give you some insight and answer some of your questions regarding myofunctional therapy. Please stay tuned and listen to our Myo Minute, and tune in to our Talk the Talk interviews with the many different medical, dental, and rehab professionals as they elaborate or answer your questions and address your concerns directly, especially when it's related to speech-language pathology and myofunctional therapy.